Hello everyone, welcome to the class. In today's class, we are going to discuss about your Unit 7, that is Introduction to the Statistics. And in the complete unit, we are going to discuss about what actually the statistics is and how it is useful in research belonging to the nursing. The statistics, it is the coin termed from a Latin word. Okay, so that is the Latin word we have here is the status. From this we got the statistics term, and also there are other languages words where we have drawn the statistics word from. That is the Italian word, nothing but the statista, which means in English it is a statement. And also it has been derived from a German word, statistic, where there will be a spelling change, and here it is a political statement. So here, by taking all these terms, this statistics have been derived, okay? And what actually this statistics is? The statistics is a branch of mathematics which is going to deal with the averages, or which is going to deal with the numbers, okay, or values. It is called as a study of figures or study of values, and sometimes like a scientist called as a Bolek, he had said that statistics is a study of averages. So here the study of averages, it is saying that in the statistics mostly we are going to take the average. We don't take the absolute value. So we will be taking, because there will be a large set of the data when we do the research, and that data has to compiled into a specific set which we call it as a sampling arrangement, and once it has been arranged, then it has to be analyzed. So this statistics, we can call it as collection of the data, presentation of the data, analysis of the data, and interpretation of the data. So now by having these keywords, you can define what actually the statistics is. And this particular definition is given by the scientist called as a Croxton and Coden. These are the scientists who have given this particular definition. So, the branch of mathematics or a branch of science which is dealing with the collection, presentation, analysis and interpretation of data is called as a statistics. That's where it gives you the definition of the statistics. However, in the exam point of view, whenever you get like to get it as a very short answer type question for 2 marks or so, you can write the definition as it is a field of study concerned with the techniques or methods of, because we simply cannot collect the data, cannot interpret the data, cannot present the data. Okay, there will be certain techniques how to collect the data, how to present the data, how to analyze the data, and how to interpret the data. So all those techniques are also involved in the statistics. So a detailed statistics definition, you can tell it as it is a field of study concerned with the techniques or methods of collection, classification, summarizing and interpreting of data, and drawing the inferences. Very, very important. You are going to draw the inferences. What do you mean by inference? That means when you have performed some test, say you are identifying or you are checking the blood pressure of a patient. Okay, vitals of a patient, when you are checking especially the blood pressure, you will be getting certain value. Say it is 130 by 90 or 120 by 80. So when you have got that value, you will have some inference. What is the inference? By checking that value, you will be saying that yes, the value of the blood pressure of that particular patient is normal. Okay, you will be saying it as a normal. If it is very higher than the 120 by 80 mmHg, then what you would say? It is hypertension. So like inferences, inference is nothing but drawing a little conclusion depending upon the result that you have obtained. Okay, inferences. And the next one is testing hypothesis. Hypothesis is nothing but assumption. before performing a research, you would be assuming something. Say for example, one patient has come to you with a lot of sweating and he is getting a pain on the left arm and he is not able to raise the arm as well. So what you will assume by seeing that patient, you may assume that there is some cardiac problem for that patient and he is suffering from some blood pressure issue. So immediately what you would do, you would check the blood pressure, you would be giving some sublingual tablets, okay, so that to calm the patient first, and then you will be going for the next treatment, isn't it? So that hypothesis, that assumption, assuming that a particular patient is having some cardiac problem is called as a hypothesis. And then finally, making references. All these together we define the statistics. So once again, the statistics is nothing but it is a field of study concerned with the techniques or methods of collection, classification, summarizing, interpretation of data and drawing inferences, testing hypotheses and making references. And however, here we have one more interesting term called as a biostatistics. You would have listened this term good number of times, saying that it is a branch of statistics applied to medical and biological sciences. Absolutely, because lot of research would happen in the medical and the biological sciences. So separately, there is a term called as a biostatistics where we will be implementing these statistics terms especially to the medical and the biological sciences. And this term is used when the tools of these statistics are applied to the data that is derived from the biological and health sciences like medicine, biology, nursing, public health, pharmacy, and all those things. So that is the biostatistics, especially when we use the statistical techniques in health sciences or the biological sciences. So all our nursing, pharmacy and public health, everything comes under the health sciences. So now we have understood what actually the statistics is and why the thing that we have to go with the statistics especially. What are the uses of the statistics? Why we have to go with the statistics? Can't we interpret the results without using the statistics? Let us see. Okay, so the first use of this is it presents the facts in a definite form. Okay, it will present the facts in a definite form. Definite form here in the sense, if it is right, it is right. If it is wrong, it is wrong. That is called as a definite. We cannot say by applying the statistics, it may be correct or it may be wrong. We cannot say that. Say, for example, you are testing a patient for diabetes. If the diabetes, you know what is the actual value, it should be there before taking the food, like fasting glucose levels and the postprandial glucose levels, you would know. So, by observing the values that were given by the blood test of the patient, you cannot say that like he may have the diabetes. No, we cannot say that he may have the diabetes. Whether they are having the diabetes, yes, they are having the diabetes, or no, they are not having the diabetes. However, when we do the research, we won't take one person. We take a set of population. We take a set of samples, like say, depending upon the sample size, we may take 50 patients, we may take 100 patients, or we may take even 500 to 1000 patients as well. So, while you are combining the results of all those patients, we will get n number of values. Okay, we get confused when we see those values individually to determine whether that set of population are really diabetic population or really the non-diabetic population. So, we go for the statistics, we take the averages and we come to the conclusion whether that particular population is diabetic or non-diabetic. That is, it presents the facts in a definite form. Second use is, it facilitates the comparison. Absolutely, it facilitates the comparison. Why we have to compare? For determining something, definitely a comparison should be there. For example, when you are sitting in a class and when you are discussing about some experiments or something, some people will grasp it very fastly and some people cannot grasp it very fastly. Okay, in a class of 60 or 50 students, the lecturer would say in a same way to all the 50 students. But however, all the 50 students does not get first rank and all the 50 students does not fail even. Okay, there is a difference. Why there is a difference? The comparison comes here. Even when you are treating the patients, you won't treat the patients, all the patients in the same way, isn't it? Why you are not treating all the patients in the same way? Because each and every patient is unique with their characteristics, with their metabolism characteristics, with their pharmacodynamics, with their pharmacokinetics, isn't it? So when we take these into consideration, you have to compare. Like for example, you will be giving the drugs, you will be giving the medicines in different doses for different age group of the people, is it not? You won't give the same medicine for pediatrics and the same dose will not be even given for the adults. Why there is a difference? You are comparing that the adult is not equal to the pediatric. So pediatric, as that particular child is having some peculiar characteristics when compared to the adult, you will be giving less dose to the pediatrics and more dose compared to the pediatrics to the adults. So there is a comparison. So this statistics will allow you to compare. Okay, so while doing the research also, you will be comparing the results with the control group and the test group. You will be keeping one control group. Control group is nothing but where you won't be treating that group with any medication, whereas the test group is the one where you are treating that with the medication. So the comparison should happen. And then the next use is simplifying the figures. What are the figures here? Figures are nothing but the values. We will get enormous data while performing the research. In any of the field, while performing the research, we will get enormous data and that data has to simplify it. How simplifying? Simplifying here is not like deleting some data. Simplifying in the sense here, instead of taking all the data, you may take the average data. Okay, you may take the average data or like geometric mean, arithmetic mean, like that you will be taking different types of the data. It is nothing but simplifying the figures. That means reducing the number of steps that you have to perform in finally interpreting the results. You are going to simplify the figures here. And then the statistics, it also helps in formulating and testing the hypothesis. In formulating and testing hypothesis. So what actually we are doing here? I said what is a hypothesis is, isn't it? So whether your hypothesis is right or wrong, whether it is accepted or rejected, we are going to see with the help of the statistics. And finally, it is going to help in prediction. It is helping in the prediction. What is prediction? Nothing but your hypothesis. So by seeing a set of people, or during the COVID time, we expected that there would be, like, once the second wave has finished, then we have predicted that the number of cases would reduce. Why the number of cases would reduce after the second wave? Because everyone has got the herd immunization. Herd immunity, we have said that. Herd immunity is nothing but unknowingly it has spread in the large population and the people have got immunity. So now, even though they are coming in contact with the infected person, the rate of again getting that particular COVID-19 is, it has been reduced. Okay, it has been drastically reduced where the people has got the herd immunity, right? So in that cases, we are going to predict by using this statistics. Okay, so all these are the general uses by utilizing this statistical applications.